So under the social pillar of the Kenya Cancer Transformation Plan, we as a team or the committee of the PSS are visiting Nakuru, and tomorrow we'll be in Baringo. And here in Nakuru specifically, we've come to inspect projects that are being supported by the national government, supporting the counties in delivering the social pillar. The facility behind here that we have just inspected is one of the regional cancer centers that we have in the country. Regional in the sense that we are able to identify one region to serve a bigger, wider, or many counties. Nakuru is one of those counties that serves this region. Then we have Garissa and we have Mombasa to serve the coast region. Now, we've come here because we are inspecting the facility, how it is performing, and also the additional bunker that and the machine, the LINAC machine that we received as a government, being a donation from the Atomic Agency. Our role as a government is to make sure that we build the bunker to install this LINAC machine. Indeed, we are very happy with the progress of the works. It's about 65-70% complete. We've been notified by, by the contractor that there's equipment that have to be imported from all the way from Sweden, others from South Africa. And we've also agreed that we meet with the contractor to fast track that process. And next week, the project manager, myself, and the contractor will be sitting down to see and plan to ensure that these equipments are received within the shortest time possible, because we are beyond the project period. That's one. Again, we've also been engaging with the county government of Nakuru on the challenges they're facing, with the question you've asked in terms of what are the challenges they're facing. Cancer treatment is an expensive treatment. And that's why we partner with the county government to support them. I know the challenges I've been facing is on the servicing and maintenance of this equipment, and some of the items that needs to be procured are very expensive. We've supplied them, for example, not adequate. They need additional 6 machines at the cost of 6 million. That will be about 48 million. So that's the additional money that they need so that they're able to serve more patients. We have been informed that in a year they serve 600 patients. The machine that we have installed here, for example, can serve 100 patients per day. But there are challenges that are there. One is in terms of human resource. So we've just discussed with the governor and the team and the management team here, the CEO, on how we are going to increase the trained personnel. And we are very happy with the county government of Nakuru. They have already told us that they are in the process of recruiting additional specialists, the oncologists, the physicists, nurse oncologists for the facility, and that is in progress. Additional 4 more are going to be hired or recruited. The challenge that I can say currently is on the servicing and maintenance of this equipment. Whatever the revenue they receive from it is not adequate to maintain this machine, and I've called for a meeting so that the 3 regional centers can sit together. We want to plan on how then we are going to ensure that we have the proper trained personnel, the biomedical engineers that will be assigned to this facility. We received, when we got quotations from the service providers, we see it's a bit high. I want to see how we can combine so that we give either one contract for the 3 equipments, so that the individual counties don't engage one service provider. So we want to leverage on economics of scale for the cost of maintenance of our equipment to be lower. And as they lower that cost of maintenance, that means they're also lowering the cost of treating cancer. But the good thing, or the good news we have now, is that we have expanded under the Social Health Insurance Fund. We have expanded the costs. We've increased the cost of treatment, so the reimbursement to the facilities will now be higher. It's commensurate to the market price, because we realize that I think the quotation or the cost that we had put under refund for claims, insurance claims, was lower, much lower, and therefore the facility was not making any revenue. You are also aware that under the facility improvement fund, facility improvement Act, we want to make such facilities to be more autonomous, to retain the money that they generate from here and be able to plow back so that they continue providing service. So I think our business model is going to change. I've just had engagement with the team here that we need to change our business model so that we're able to have this facility sustain itself in the near future as part of these reforms and also as part of reducing the cost of treatment. So we hope this management will be able to agree on the way forward. A meeting has been scheduled for Nairobi next week, arising from our visit here. It is need for us to engage further.
Mine is to welcome our peers from medical services to Nakuru County on behalf of Our Excellency the Governor. And we are very grateful today to have them here. We have just gone around the facility, and I'm very sure by the time they'll be sitting in Nairobi, they will not be only seeing the papers we are requesting to assist us in one way or another, but he will be able to know that when I went to the facility, I was able to find out that they were short of this and that. So mine is to welcome them here and to say thank you very much for the national government for remembering us. And I promise them that we are going to work together to make sure that health facilities in our county are actually up to the standard. I really want to congratulate the national government because instead of most of the patients going to far as India, we can be able to treat them here within Nakuru County. Thank you very much. Welcome.
Maybe just a question. What are some of the challenges as a county or a facility are facing? Maybe you can partner with the national government to address.
Now, especially procuring of some of the facilities which are actually very expensive, so that if they can assist us in procuring some of the facilities, and maybe on the other hand, we can provide human labor. Yes.
Where we are accounting in terms of like how many do you serve in a day, in a week? Not necessarily from Nakuru, from neighboring counties. Basically.
Now, here, you know, as you know, the services we are offering here in the PGH are actually very good. So we serve quite a number of counties around surrounding counties, like Richo, Baringo, Laikipia, Nyandarua, even Narok. They all come here to be served.
We also going to Bahati. Yeah, we want to check on other issues. You want to be? Yeah. Sorry.
Taongelea hapa ama wanaingia kama gazeti inaandikwa leo kama nipate kwa sababu kesho ni analysis ya ina part ya budget.